Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us once again. You know, from 2014 to 2030, the number of older adults is going to grow from 46 million to 79 million. And the number of falls within that group is going to increase by 20 million, from 29 million to 49 million falls. Our guest today is Dr. Jonathan Moore, managing partner of Cumberland Foot and Ankle Centers in Kentucky. And he's going to discuss a recent study by the Journal of Gerontology that reveals that a flexible brace, the more balanced brace used on a daily basis, and ankle and foot orthotics profoundly improves senior citizens' balance by about 55%, significantly reducing their fear of falling and increasing their level of activity. Thank you for joining us here on the program today, Dr. Jonathan Moore.
Good morning, Neil. Glad to be with you.
Managing partner of Cumberland Foot and Ankle Centers in Kentucky. Obviously, you're a doctor that deals with the feet. Give us a little bit of background.
Yeah, so I'm a foot and ankle physician, and we have a multidisciplinary practice that includes physical therapy, orthopedics, and podiatry. So we also have an orthotist and prosthetist, and so we really kind of specialize in lower extremity gait problems and lower extremity diabetic issues, all foot and ankle types of issues.
You know, I mentioned that the number of falls with among our older adults is going to increase to 49 million falls. I mean, people fall down all the time. What is it about falling at an older age that's so problematic?
Yeah, that's a great question. And you know, when you consider the fact that there are going to be 800,000 patients in a year that are hospitalized because of a fall injury, and that every 20 minutes someone dies from a fall, those types of statistics should really prompt medical professionals to not only start screening patients, but really kind of putting together treatment strategies that can reduce not only those devastating consequences, but also the cost. You're looking at, and 2015 estimated cost $50 billion per year on falls. And so it's a devastating problem. And right now there really isn't a lot of studies providing really concise recommendations for physicians to put in place.
Unfortunately, there's basically a worldwide kind of a joke about, breaking a hip. If you're a certain age, you get out of bed, you're going to break a hip. You boil some water, you're going to break a hip. What is it about the geriatric stage of life that makes us keep going when we should be doing something, to prevent these falls? We know that they're coming. We know we're getting older. Our balance is affected, our eyesight, all of these things. Why do we continue to trudge?
Well, that's those are great questions. And obviously falls are multifactorial. So that, I think a lot of people think that there's maybe one or two things that causes falls, but like you just mentioned, vitamin D deficiency, obviously vision problems, but it's decreasing activity among these patients. But one of the key things that we focus on is lower body weakness and gait abnormalities. So when you have vision problems, weakness issues that are relatively normal as we age, if we're not active and we're not addressing those gait problems, those the difficulties with walking and balance, we're not going to really impact those patients. But yeah, it's multifactorial, and so a treatment plan should address not just one issue but multiple issues.
What can be done to strengthen the back, or at least support the back, because there's no stopping the aging process?
Yeah, so I'm not a back specialist, but what I would say is that what studies show consistently is that lower body weakness, so that's foot and ankle instability, those are the types of things that really are impacting gait. But yeah, certainly if patients have back problems, physical therapy and non-surgical treatments can be helpful. And in our office, when we see someone with an abnormal gait that's elderly, we immediately assess those patients for fall risk. We try to get them in physical therapy. And when we watch them walk, I try to identify foot and ankle related issues and try to address them through bracing, through the more balanced brace, through proper footwear, education. So we try to kind of hit those patients with several modalities at one time, but physical therapy is a key part of that. But also addressing the specific weaknesses, balance issues that are in their lower extremities is key as well.
When I think of a brace, I usually associate it with an injury. Now, we're not talking about a brace for injuries. We're talking about a flexible brace that is going to support the ankle and the foot. Describe this more balanced brace.
Yeah, so it's an ankle foot orthotic, and so yeah, people have visions of the Forrest Gump running down the street and metal pieces flying all over the place. Yeah. But that's not what this is. This is a custom-made, lightweight device that has flexibility, but it has stability where the foot and ankle need stability. So it helps pull the foot up because many of these patients don't have the strength to pick their foot up fully. But it also stabilizes the foot and ankle, which is a key component in our proprioceptive feedback. So when you talk about what causes balance deficits, you have to think about, well, our proprioceptive feedback is one of those things that declines in age. So we're addressing weakness, we're addressing proprioceptive loss, and we're also addressing, of course, the specific gait issue that they have. So this is a lightweight device. It goes up just above the malleoli. It obviously stabilizes in the lateral plane and the frontal plane, but it doesn't restrict normal activity. That's the key. It's flexible enough such that it doesn't inhibit a heel-to-toe gait.
This is not like a support hose or anything like that. Is it worn over the shoe, under the shoe? How does that work?
Yeah, so it's an ankle foot orthotic is a device that is made from a mold, and it consists of a light, flexible plastic. And so it goes around the ankle over a sock, and then it goes in the shoe. So because this is so lightweight and kind of very minimalistic in its size, it fits into most types of shoes. So it's not really a challenge in that respect. So yeah, it's a brace, but it's not the type of brace that people think of. And so when we bring this in to show seniors, we always have something in the office to show them, and it's a relief to them to see it's not something bulky, heavy, and obtrusive.
Is it something that can be adjusted as the patient gets older, or as the patient possibly improves?
That's a great question, and the question really comes down to: are these patients? And we always want to get them in physical therapy, but this brace and custom bracing typically is employed in cases where the patients are likely going to have this condition for more than 5 years. So in most of these cases, these patients, although we want to improve strength, we want to improve balance, so we're going to do those things, most of them require them for the rest of their life. And so, but are they adjustable? Absolutely. We have a full team of people in our office, and most healthcare professionals will be using companies, individuals that have the capability of adjusting these. But you'd be surprised that most of these don't require a lot of adjustment because there's not lacing, there's not latches, it's Velcro, it's very simple. Yeah.
As far as the cost of the device, is it covered by all Medicare, Medicaid? Is it something that's going to be easily accessible, and is it easily accessible now?
Yeah, so that's the beauty of this program. So what we advocate is that the more balanced brace be really kind of a centerpiece of a menu of different things that are employed. So and yes, the brace is covered, and again, these are used bilaterally, Neil. So these are not used on one foot, but these are dispensed to be used bilaterally. They're custom. Most all insurances cover these without any particular issues. A proper documentation by the physician and is required, like most durable medical equipment items. But when we employ the AFO, we're also employing physical therapy regimen. We're also employing getting the right shoe in place. So there's just like I said earlier, you have to approach these patients individually. Many of them are going to be on a number of medications that you have to address. Many of them are going to have other issues, but really the balance AFO, proper footwear, and education and exercise really is the fundamental kind of foundation for starting someone in a good fall prevention program.
Jonathan, where can our listeners go and get some more information online about Cumberland Foot and Ankle Centers in Kentucky?
Well, so for those that are local, we're at www.myhappyfoot.com. And so that's pretty easy to remember. But for those that want to, that are interested in learning more about, of course, the brace itself, very simple, ArizonaAFO.com. So it's www.arizona, and then AFO.com. And they can get more information about how to order that and what physicians in their area may be able to help.
Dr. Moore, thank you for joining us here on Health Professional Radio. It's been a pleasure speaking with you.
Well, same here. It's a pleasure speaking to you too. God bless.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.